Hello, everyone. Welcome to this evening's 2023 Yale Angels Pitch Off. It's a pleasure to welcome you here this evening. And I just want to welcome all of you for another year of amazing startups from the Yale ecosystem pitching their incredible ideas to the Yale community. My name is Wendy Maldonado. I'm Yale College class of 1993, and I'm the executive director of Accelerate Yale and Yale Angels. We are so pleased to have you here this evening. Accelerate Yale and Yale Angels is a global community of diverse alumni and friends of Yale who are engaged in innovation, tech, and entrepreneurship. Our pitch off this evening is sponsored by the Yale Office of Development. And the Yale University Office of Development is proud to sponsor the Yale Angels Pitch Off. Yale supports access, innovation, and breakthroughs for all of humanity. We invite you to join us and declare boldly, what are you for? You can learn more about Yale's groundbreaking For Humanity campaign at forhumanity.yale.edu. And I'm going to just share their beautiful slide here in just a second. I should have had this teed up for all of you guys, which I did. So just give me 1 second here. I'm going to share that. Oh, shoot. Okay. I'm going to get that in just a minute. I'd also like to thank Yale Ventures for its bronze sponsorship of this evening's presentation. They were also a sponsor of last year's event. And we also wanted to acknowledge all of our partners who made this event possible, including the Yale Alumni Association shared interest groups, and all of the shared interest groups and organizations who partnered with us to make this possible. That would include Yale Women, First Gen Yale, the Yale Latino Alumni Network, Yale Gala, Yale Blue Green, Sci City, the Yale Club of Silicon Valley, the Y Startup Index, and Yale Fin. So thanks to all of you. Please note that we are being recorded this evening with all participants muted. Tonight's session will last approximately an hour and 30 minutes. We won't be taking questions from the audience this evening, but please do put your name and LinkedIn into the chat and your Yale affiliation, just so we can all see who's here. We will hear from the startups very shortly, but first I would like to introduce my teammates, Joe Ilfeld, Yale College class of 1996, and Ellen Sue, Yale College class of 2013.
Thank you. Thank you, Wendy. It's really wonderful to be here today as part of the Yale Angels Pitch Off. And it's exciting to see the numbers climbing as people join. And we have amazing teams for you tonight to listen to. We had almost 80 incredible submissions to this pitch competition. And it was really thrilling to see how many entrepreneurs there are in the Yale community and just how determined everyone is to succeed. Before we hear the pitches, I have the honor of introducing our rock star judges for the evening, and I'd really actually like them to introduce themselves, their Yale year, their company, and where they are based. So Tessie, will you start us out?
Sure. Hi. Thanks, Joe. Thanks, Wendy. I'm so excited to be here today. My name is Tessie Decker. I'm a Yale College 97 grad. I am currently an angel investor and most recently was the fund manager for the Seattle Angel Conference, where we just awarded about $200,000 to our winner. I'm based in Seattle, so look forward to hearing the pitches tonight.
Thank you so much, Tessie. Allison, can you introduce yourself now?
Absolutely. Hi, everyone. And again, thanks, Joe, for having us. So I'm Allison Pickens. I used to be COO at a SaaS company called Gainsight. Currently, I'm running a venture fund of which I'm the sole general partner. I'm also on the board at DBT Labs and Commvault, which is a public data protection company. And I work with companies all around the world.
Awesome. Thank you, Allison. Lindsay, you're up now.
Great. Thanks so much for having me, Joe and Wendy. It's great to be here with you all. I'm Lindsay Siegel. I'm head of impact at Company Ventures, a VC fund that's based in New York, and I am here in New York. Excited to see the pitches, though.
Thanks, Lindsay. And last but of course not least, Gary, will you introduce yourself?
Hey, so I'm Gary Stewart, Yale College 96, Law School 99. Teach occasionally at the law school, also as an adjunct professor in entrepreneurship. And I'm the managing director of Techstars New York City, powered by JP Morgan, which is one of the world's largest pre-seed funds. And I'm here in New York.
Awesome. Thanks, Gary. So thank you, judges, so much for joining us this evening. And now it's almost time to get to the star attraction, the pitches. But before we do, I'd like to explain our format for this evening. There are 5 final teams, and once again, they were selected from a pool of nearly 80 applications, 79 if you want to be exact, and all have some affiliation to Yale. So the way we're going to do it is each team will have 5 minutes to pitch, and we will be really exact on those 5 minutes. So we will mute you. The ventures know this, so that you, the audience, aren't shocked when people get muted midway. We will mute them just in fairness to everyone, and then we'll have about 5 minutes for the Q&A with the judges. After all the 5 teams have pitched, the judges are going to depart to a separate Zoom room, and we will take about 10 to 15 minutes with the judges to choose both the winner and the runner-up. And just so that you know, there are 2 cash prizes tonight. So the winner and the runner-up both get cash prizes. During these 10 minutes, the members of the leadership team of Accelerate Yale and Yale Angels will join us, and they'll highlight the semifinalist teams who didn't quite make it but were still extraordinary companies, and previous pitch competition finalists. Where are they now? So finally, please use the chat it up, tell us what you think of them, offer advice to them. They will get the chat recording later. They will love hearing your advice. You can put your questions. They would love hearing your questions and what you wanted to know that they didn't say in their pitch. But we won't be accepting any questions from the audience. So that will just be used sort of as great market research for these companies moving forward for our finalists. And one last thing before I get started, I wanted to give a huge special thank you to fellow Yaley Alden Richards. I saw him in the chat, so I know he's here, class of 77, and he volunteered his marketing and presentation expertise to all 13 of the semifinalists and then the 5 finalists. And in that short window of time, he gave such amazing advice to these teams. They all raved about how helpful he was. And us looking at these semifinalist pitch videos, we're just amazed by how much Alden can help them shape their pitch in a small amount of time. So he's provided support to more than 700 startups over the last 15 years. And so our teams were lucky to have access to him, and the value of his pro bono services totaled over $8,000. So thank you so much, Alden. I know everyone who used you just raved. And now on to Ellen and the big show.
All right. Hello, everybody. This is the most exciting part. It's featuring our finalists here. Thank you, Joe, for introducing the judges. We are very excited to be, honored to have our judges participating here and having eyes on our finalists. So we're actually going to go in alphabetical order. So our 5 finalists are Ecopackables, presented by Shervin; Mission Driven Tech, presented by Oni; REALIEF, presented by Claudia; StaffOnTap, presented by Kayla; and ZAMA Health, presented by Brendan. So first off, I'd like to introduce our very first startup to the stage, Ecopackables. Let's welcome Shervin. Good luck, and please remember, Wendy will let you know when your time is up and your sound will cut off. So you've got 5 minutes for your pitch and 5 minutes for questions. Why don't you take it away?
Sounds good, thank you. Can you guys see this?
Yep.
Okay, cool. Wait 1 second. There we go. What's up? My name's Shervin. I'm the founder and CEO at Ecopackables, and we're solving plastic pollution with a real solution. Now, the packaging industry is the #1 producer of plastic and paper waste globally. The scary part is that just 9% of this gets recycled each year. The rest is either incinerated, ends up in landfills, or left to pollute our waterways and wildlife. It's also a very broad category, and so for us to have a meaningful impact, we have to pick an area to specialize in. And we specialize in e-commerce packaging, which is a $70 billion a year industry growing at 17% a year. This makes it the fastest growing segment in packaging as well. but it's littered with three main pain points. The first is it's incredibly outdated. The cardboard box has been around for 95 years and has not changed at all. On top of this, government legislation is beginning to penalize brands that use irresponsible virgin plastics in their packaging. And lastly, a new wave of more responsible consumers are beginning to demand more sustainable practices from companies. And unbranded, unsustainable packaging leaves a very weak first impression. We solve this through the sale of our sustainable packaging materials that are customizable and innovative. The three materials we work with are our 100% compostable D-film, which is a proprietary film made of cornstarch, cassava root, and a few other biopolymers. We also work with 100% recycled materials as well as 100% recycled paper materials. What we do is we take these materials and manufacture them into unique end-of-life applications for these clients. Now, one of the products we recently made was a 100% recycled honeycomb paper padded mailer. And this serves as an alternative to cardboard boxes, but it's more sustainable and cheaper as well. We also make compostable mailers as well as compostable food-safe pouches. The companies we generally work with are CPG brands that have between 11 and 500 employees. This is because they're not super massive to the point where packaging is just a commodity to them, but they require packaging to be a marketing asset. And so they invest in its customizability and they invest in its sustainability as well. We've seen a lot of success targeting these clients. In the past 8 months, we've sold over 11 million polybags and have signed partnerships with companies like Procter & Gamble, Saks Off Fifth, and Ted Baker London. Packaging being packaging, we do have 3 competitors that also make sustainability their true North Star, but they're primarily focused on the smaller individual e-commerce merchants, and they also distribute off-the-shelf existing sustainable packaging. We understand that to have the biggest impact possible, we need to partner with B2B clients, but also innovate and create our own products too. We differ from legacy providers because our materials are far more cutting edge and sustainable. We're also customizable at much lower minimums. The industry standard to customize a polymailer is 1 million units. We're at 5,000 units. So this helps us serve that untapped market I was talking about earlier. And also, we're an innovator, not just with our product, but with our technology and our approach as well. This year, we built out a packaging API called Sense of Purpose, and it solves our clients' biggest pain points, which is sustainable packaging can be expensive. So what this does is it automatically syncs with our client's website front end and lets the customer choose sustainable packaging at checkout. They can either round up their order for a very nominal fee or pay a very nominal fee. And I'm talking like 5 to 10 cents. And this is going to help subsidize the cost of sustainable packaging for brands. And we're currently beta testing this with Roan and Ted Baker. I'm currently a Yale College student, and I was fortunate enough to make the Forbes 30 Under 30 list this year for the impact that we're making at Ecopackables. And in 2023, we're looking to bring on a CTO, 4 new sales reps, as well as a polymer chemist. We also differ from most traditional startups because we're completely bootstrapped. We were started just 2 years ago and are cash flow positive as well. In 2023, we're projecting to do over $4.5 million in revenue. And with partnerships like Amazon Style still in their very, very early stages, we're super excited about the impact that's to come. But at the end of the day, our goal is to eliminate the use of virgin papers and plastics from packaging. And as a consumer, you have so much power. So the next time you receive a shipment that's irresponsibly packaged, please let the brand know, because it's only by doing this that we can solve this battle and raise awareness together. Thank you.
Judges, you have 5 minutes for questions. Gary, let me know if you're having trouble. Oh, there you are. Okay. All right, I'll start the timer now. Judges, go for it.
I have a question. What's preventing someone from replicating the materials that it sounds like you feel are core to your differentiation?
Great question. So what we do is we aren't a polymer chemistry company, but we partner with polymer chemistry companies. So one example of a material we use is PHA. It's made by a company called Danimer Scientific, and we sign an exclusive distribution agreement to use PHA in a flexible film format. So the R&D I was also talking about with a unique product is we're the only ones that can use that PHA. So we then partner with a manufacturer to figure out, okay, how do we make this pellet into a usable form of packaging, right? Because you have to trial for more moisture transmission rates, oxygen transmission rates, tensile strength, melting points, things like that. And so there's a lot of R&D to make a new material actually usable. And since we've invested pretty heavily in that, we now do have a very differentiated product that we can generally make.
Thanks, Sherwin. I have a quick question for you. I'm curious what sort of studies you've done on life cycle assessment. For example, if you've got these compostable packages and they end up in a landfill, what happens there? Do you need sort of large scale composting in order to manage that waste in a more effective way? Curious what you've been looking into here.
It's a great question, Lindsay. And it's one that we talk about all the time as a company. So the first thing is we have certifications on all our products, right? So they're certified by the BPI as well as the TUV for home composting. But to take it a step further than that and look at the true life cycle, right now in our current landscape in America, I would be lying if I said composting was a very popular form of disposal. So the majority of these we recognize are going to end up in a landfill, where oftentimes landfills are in oxygen-rich environments and they will end up producing methane. But the pitch for compostable, and the reason why we've been able to convince Ted Baker to use them nationwide, is it's a forward-looking material. You have states across the country like California that are rolling out home composting and taking these initiatives because recycling, it's one form of waste management, but it's not the end-all be-all. We need to invest in forward-looking materials. And so our pitch is, by using compostable materials, you pressure legislation to start building out more infrastructure to then take these compostable materials. But if we never did it in the first place out of fear that some might end up in the landfill, we would never see too much progress in this space. And the last thing I'll say on the landfill is they contain zero plastic, right? So the polyethylene structure doesn't exist. It breaks down into organic biomass, water, and CO2. Or if it's oxygen deprived, it breaks down into methane.
Sorry, I don't know if I missed it. First of all, good pitch and great traction. So congratulations. My question was, can you just remind me like what you said the total addressable market was?
Yeah, so I mean, packaging as a whole is a massive market, right? So to start, because our films can be applied to food safe as well. We now can make coffee pouches as well. But to start, we needed to narrow our focus to e-commerce packaging. So picture when you order a shirt, it's delivered to your door, right? That's kind of what we focus on right now. And that's a $70 billion a year industry growing at 17%, which makes it the fastest growing segment in packaging too.
But is there a sense there as to kind of what section of that would be for, you know, your sort of product? I mean, that may be the overall market. Maybe the question really is, what do you consider to then be your serviceable, obtainable market?
It's the entire 70 billion. This is already tranched off. So this is for CPG e-commerce is 70 billion. Broader e-commerce, which includes like pallet shrink wrap and like bigger moving boxes, things like that, we don't include into this. That actual market is a lot bigger. It's closer to 280 billion. So this is already tranched off. And it often surprises people to see such a big industry, but every single thing we use has packaging, which is why it's the #1 producer of waste. It's just incredibly archaic and no one thinks about it. And this is why it's an incredibly fragmented industry, but it's also incredibly large.
All right, that is time on our questions as well.
Awesome.
Excellent. Well, thank you so much, Sherwin.
Of course.
Excellent. Well, I'd like to pop in here and introduce our next venture. That will be Mission Driven Tech, presented by Oni. Please join me in welcoming Oni to the screen.
So, hello, we're going to be pitching myself, the CMO of Mission Driven Tech, and Eve McDavid, the CEO of Mission Driven Tech. There's a major problem in cancer care. When men get cancer in their reproductive organs, they survive. And since the 1970s, their survival has improved to nearly 100%. In contrast, when women get cancer in their reproductive organs, they're more likely to die today than they did in the 1970s. My name is Dr. Oniye Balogun. I'm an oncologist with 20 years of experience at some of the best hospitals in the world. I treat women with cancer every day, and I can tell you firsthand that gynecologic health is in dire need of disruption.
Hi, everyone. My name is Eve McDavid, and I'm the CEO of Mission Driven Tech. I'm a former Google executive who survived a cancer diagnosis and saw firsthand how better technology can reverse these trends that Oni has described and scale better outcomes to women globally. Our founding team represents the bridge between the best of medicine and modern technology to change the future of women's cancer care.
Gynecologic cancers and related conditions like HPV infection affect 9 in 10 women. More than $107 billion is spent on treatment. In some instances, treatment costs 1,000 times that of preventive care.
And so this is why we built Touch. It's a suite of digital and hardware solutions to disrupt gynecologic cancer care. Touch is a HIPAA-compliant telehealth platform that offers access to world-class physical, mental, and sexual health providers available from home or in any safe space. It addresses the misinformation, stigma, trauma, and systemic inequity that prevent women from accessing the quality information and quality care required for the best possible outcomes. We start with offering telehealth services, and our platform is designed to also include premium inclusive content that covers hard to discuss but important topics across the entire care continuum. Community features also engage and empower users, which are proven to clinically improve outcomes as well. We're launching with the focus on cervical conditions, and success here will then scale next to uterine and across gynecologic health and women's health more broadly. For our go-to-market, we are working with health systems and payers because they experience the highest burden of treatment costs, where, as Oni mentioned, preventative care would be 1,000 times less the cost. And their treatment costs are also associated with poor patient outcomes. We're also testing the platform with end users who pay a monthly subscription fee, and we also make money on referrals to in-person providers. This is a market that represents over $107 billion in treatment costs, as Oni mentioned, and capturing just 10% of this opportunity results in over $150 million in annual recurring revenue.
Touch is part of a broader digital and hardware ecosystem that includes a new patented medical device that cures cervical and uterine cancers. Feedback from our initial users has confirmed the relevance and the importance of these solutions. We have people telling us that they wish they'd had this when they were going through their initial diagnosis. And we also have medical professionals confirming that these solutions, both the medical device as well as the digital platform, are key. While other players exist, we're the only digital and hardware ecosystem that offers inclusive, medically accurate, and trauma-informed care, content, and community, all which are proven to improve health outcomes. We've built a wide coalition of investors and partners who are supporting our work, and we also have additional product development underway.
We're presently raising a $2 million pre-seed round to fund key engineering and provider talent, further develop the platform, and attract customers. Winning today's $10,000 investment will go toward our content distribution and user acquisition strategies. Gynecologic health is in severe need of disruption because in 2023, women deserve better. And so we invite you to join us as we transform gynecologic care. Thank you.
Judges, you may begin your questions.
Thank you both. what is exactly the root cause for why women are more likely to die today from these cancers than 30 years ago, 40 years ago?
So one of the things that has come forward is lack of knowledge. So that's one of the things we're trying to tackle with our platform. We have a number of different articles that demonstrate that people say, well, I didn't know that I was supposed to go for cervical screening at this time, or to get HPV testing at this time. We have survivors, articles also showing that individuals, especially children who are survivors of cancer and have a higher risk of infection with HPV and then going on to die of cancers, their parents don't know, they don't know that they should go and explore things like HPV vaccination or go for regular screening. So one of the big gaps is education and lack of knowledge. And I think one of the other issues is that we have not invested enough money in these ventures. The amount of money invested in prostate health really dwarfs. It's hundreds of times higher than that's been invested in things like women's health. So those are two of the major things that are leading to us not being able to have the same outcomes as men have had when they have cancer in their reproductive organs.
Thank you.
Hi, thank you both for the presentation. I'm curious where your primary focus is with getting started here. You sort of mentioned an enterprise focus and a consumer focus. Which one is most important for you?
Yeah, that's a great question. So the consumer focus helps us really ensure that we are building a completely insight-driven product. We're making sure that we are designing the tools and technologies to address the needs of each woman and person with a cervix who needs to access, again, quality information and quality care. But where we really get to scale is through enterprise systems, health systems, and payers. They have the greatest incentive to invest in solutions that are going to reduce the costs and burdens on their care system. So the user testing helps us understand we're building a product that is answering the needs and the demands and the problems that go unanswered today. And the health system partnerships help us get to proper scale.
And you mentioned, just briefly follow up, you mentioned you had a wait list. How many folks do you have on your wait list currently?
Yeah, we just launched the waitlist in May, and we're above 100 users on that.
Thank you.
Mm-hmm.
I have a quick question, if you wouldn't mind. This is a great presentation. I would love to learn a little bit more about your team, though, and especially the connection into the health systems, right? I know that you have some medical expertise on your team, but can you tell us more about how you'll have the right folks in place to navigate these convoluted systems?
Yeah, so clearly I'm the physician on the team, and we already are in talks with my health system here in New York, who's very interested in taking this on and adapting it for New York Presbyterian. We've also had a lot of interest expressed through talks that we give when we go out to speak at different events. We've been approached by Northwell, Yale, yeah, of course, yeah, and Tufts, among other institutions. So we believe that we'll be able to garner the support that's needed from the different health systems. And we're in the process of, with the money, we're going to get additional support in terms of personnel who will help us take on some of this. For instance, we want to have a go-to-market specialist as a permanent part of the team. We've been in touch with some of them, but we want to have that person permanently part of the team to help us navigate how we do this properly.
Just a quick follow-up question. Do you need FDA approval for the hardware piece? Or sort of how does that hardware piece play in?
Yes, that's correct. The medical device is a class 2 device and it follows the 510(k) process. The predicates are actually the tools that are used in practice today, only use them this week in procedures. So we have a really robust clinical testing plan in place with Weill Cornell Medicine and a smooth regulatory process ahead.
And time. Thank you
Say
very
that?
much, Mission
Oh,
Driven.
that's fine. Yes.
All right.
Thank you very much.
Excellent. Well, thank you so much to the team. Really great to hear from y'all, and thank you so much for the judges for the questions. Next up, we have REALIEF. Please join me in welcoming Claudia up to pitch.
Hi, everyone. I'm gonna share my screen. Okay. Hello, my name is Claudia C., and I'm excited to present REALIEF, which is a patient-controlled dispenser and deactivator of liquid oral pain medicine. Our device transforms the way pain is managed. Let me introduce you to a patient. Mary just had spine surgery and is in constant pain. She has to call a nurse every time she needs one opioid pill. Meanwhile, her nurse, Katie, is stressed and overworked because of the nursing shortage, and she cannot keep up with her patient requests. Half of her time is spent managing pain. Because her nurse is busy, Mary has uncontrolled pain, lost sleep, prolonged hospitalization, and ultimately readmission to the hospital 1 week later for pain. In reality, Mary is just one of 100 million patients every year in the US who struggle with acute postoperative pain. Currently, patients like Mary have 3 options. They can receive pills from nurses, which we have just discussed. They can receive liquid medicine through the vein using what is called a patient-controlled analgesic pump, also known as a PCA pump. However, this is invasive and not indicated for most patients. Lastly, they can receive pills from a PCA box that dispenses pills, but these boxes can still be misused and diverted. When we say diversion, we mean people illegally using drugs that were not prescribed to them. If all of these methods don't work, what will? Our solution is simple. It repurposes a traditional intravenous PCA pump for oral consumption of liquid medicine, such as opioids. First, patients press a button. The PCA pump pumps the dose into the medicine cup. The patient drinks the dose by sucking out of a straw, and any excess medication left over will be deactivated in the waste reservoir using activated charcoal and solidifier. This is our primary product for use in the hospital. Our second product for use at home will have remote monitoring by providers. Our device revolutionizes pain management because it is personal with fingerprint validation. It's safe because whatever is not used is destroyed. It's customizable and trackable by physicians. As we developed our device, I personally did extensive interviews with patients, nurses, pharmacists, and hospital administrators. Patients clearly liked the independence of our device, and nurses told us that half of their time is spent managing pain, and they rated our device favorably over pills. If we can have that time, think of how much that would reduce the workload of a nurse. Compared to pills, PCA pumps, and pill PCAs, our device is superior because it is the only device to provide safe and cost-effective delivery of liquid medicine across all the aspects that are most important to patients and nurses. On the patient side, our device has a user-friendly interface app that shows how much medicine you've taken and adjusts your next dose based on pain level. On the provider side, providers can see real-time data of medicine consumption and remotely modify prescriptions. This is a B2B market opportunity. Of the global pain management market worth $27 billion, we initially planned to capture $4.4 billion with liquid opioids. Our beachhead market is patients undergoing major surgery, such as orthopedics. Hospitals will want our device because per device, they will save about $2,600 or 35% compared to pills. Patients and insurers will also want it. By 2030, we project to earn $365 million across US hospitals. This assumes that we have 100,000 hospital users and 2.5 million home users. So far, we have filed 2 provisional patents and built 3 prototypes. Last August, we won the largest innovation award from the Yale Hospital. In October, our device was endorsed by the largest international anesthesia meeting. This summer, we have just filed a utility patent and are currently building 30 units with a contractor. Our utility patent covers all aspects of device design, from prototyping to the software interface. We have ambitious goals. Timing is crucial, and we need the $10,000 Yale Angels Prize to do two things: complete our clinical trial at Yale next year, and secondly, submit our device for 510(k) regulatory approval. This is really just the start of our venture. We are excited to expand into the cancer market, where patients experience varying pain, the palliative care market, where comfort is the #1 priority, and even the sickle cell market, where patients constantly experience pain crises. Going back to our initial story, with our device, Mary now gets the pain medicine she needs, and she leaves the hospital 2 days earlier. Nurse Katie has almost eliminated her workload, and she has more time to spend with patients. It's really a win for everyone. For the past 2 years, my two faculty co-founders, Dr. Jinlei Lee and Dr. Daniel Wisnia, and I have been working nonstop on this idea. We bring unique subject matter expertise in anesthesia, consulting, and engineering, and have a robust team of advisors, including Yale Ventures. We are so excited to bring this technology to the world of pain management and hope you will help us accomplish that. Thank you very much.
Judges, you may start your questions.
Okay, I'll jump in. Good presentation. I guess 2 questions. One, can you tell us a bit more about the patents and what specifically it protects against? Because I guess the question would be the defensibility. And then the second question is, what is your time frame for when this is actually going to be in the market?
Yeah, that's a wonderful question. So I'll start with the first one, the patents. So on the screen here, you'll see that this is what has just been captured in our utility patent that we filed in May. And it's with the PCT and the US Track 1 applications. And it really covers all of the prototypes we have built so far here at Yale, as well as animation and SolidWorks model that I created, and also drawings that the patent team created. And it covers all of the unique security features of our device, the remote monitoring, and it also protects from others using the PCA pump for the same purpose. And your second question was on timeline to market. So let me switch to, so in terms of timeline, we are anticipating launching our device in the summer of 2025 here at Yale, as well as at neighboring hospitals. And we anticipate quickly getting traction across many hospitals in the US after that.
Thanks.
Thanks for your presentation. Have you done any work to see how your device would impact addiction rates to pain meds?
That's a really great question. And we have not yet had the chance to do that research. However, we do think that this will help improve healthcare disparities, particularly among women and people with lower socioeconomic status who are known to experience more pain but be undertreated by providers. And so we think that this device will objectively help correct some of those biases in treatment.
Hi, Claudia. Can you explain a little more where the cost savings are coming from and what pricing you might apply for a hospital with these devices?
Yeah, absolutely. Those are great questions. So here you can see the unit economics. This, of course, this is pills, and this is our device at the bottom. We anticipate major savings due to reduced hospital stay, okay, of 1 or 2 days, reduced workload on nursing, as well as reduced overhead costs from healthcare systems. And so unit cost that we're going to sell at is around $300. And compared to pills, we believe that looking at the patient's entire healthcare journey, it would still save $2,600 because of the increase, the lower hospital stay length.
And would this be covered by insurance, or is this?
Yeah, that is also a great question. In terms of our reimbursement strategies, we do anticipate that insurers would want to cover it. So we could either use existing DRG, CBT, or HCPCS codes at home, or perhaps file for a new code ourselves with the help of an insurance company.
Thank you.
Just wanted to mention that we have a similar device that's out on the market. It's called OnkiPump. It's actually used often here at Yale, and they provide a pump for home use, and they actually show that patients went home one day earlier, had lower pain scores, had greater satisfaction. And so those are where you can see where some of the healthcare savings can come from. And it's great to see that it's already been proven by other similar products.
So much, Claudia. I have a similar question to the question I posed to the last team, which is about your team itself and the core team's experience with commercialization and sort of how you're going to get to market penetration.
Yeah, absolutely. So yeah, Dr. Jinlei Lee has decades of anesthesia experience here at Yale. Dr. Daniel Wisnia is very involved in the medical device space, as am I. I worked for 2 years at Medtronic as an R&D engineer for Class 3 heart valve implanted devices. And so I'm working closely with the engineering team to build our device right now. And so I think together we bring the engineering, the medical experience that is necessary to really bring this to market, as well as regulatory. Thank you.
Thank you.
All right. Thank you so much, Claudia. And again, thank you to the judges for the great questions. I'd like to introduce our second to last team, which is StaffOnTap. And I'd like to bring up Kayla to the screen.
Thank you. Hi, everyone. I'm Kayla Woolley, the founder and CEO of StaffOnTap. StaffOnTap is an online marketplace connecting understaffed nursing homes and temporary nurses. There's a national shortage of nurses working in senior care, and this is causing nursing homes to stop admissions, face fines, and close their doors altogether. In fact, 78% of nursing homes in the US are concerned that workforce challenges might force them to close. On top of this, state and federal governments are increasing the regulated staffing levels in nursing homes. This means more nurses are needed on top of the current shortage, an additional 200,000 more nurses. In Connecticut, they actually just increased it on March 1st of 2023. In 2 years during the pandemic, nursing homes lost 250,000 caregivers. Top reasons for them leaving included low pay, forced to work too many hours, and constantly having to work at facilities that were short-staffed. After hundreds of customer discovery interviews, I found that nurses did want to come back to the industry, but on their own terms. They want to decide when, where, and for how much they're going to work. They also want an easy platform where they can browse available shifts across the state that really fit their own lifestyle. I'm a third generation in my family's business of nursing homes. I've grown up working in nursing homes. For years, I've operated nursing homes, studied staffing patterns at the Yale School of Public Health, and conducted hundreds of customer discovery interviews during my MBA at Cornell. I've always had a passion to improve the quality of care for seniors in America, and with StaffOnTap, I can do that. So as I mentioned, StaffOnTap is a two-sided marketplace. On one side, we have the understaffed nursing homes looking for last-minute temp help to fill their upcoming schedule holes. And on the other, we have per diem nurses that want a side gig here or there, but all about flexibility. This is an incredibly regulated industry, and so we take care of that. The nursing home knows that when a StaffOnTap nurse comes to their building, we've done all the background due diligence, so they'll be in compliance with the state. For our nurses, we take care of all the paperwork, business in a box, and we deal with the payment as well, so they can do what they love. In terms of our business model, the nurses and the nursing home can both post shifts at hourly rates. We add a flat transaction fee to each booking and then process the transaction through our platform. On average, our nurses want to work about 2 times per week. So this means an average annual extra income of about $58,000 for each nurse. The annual net revenue to StaffOnTap from each nurse is about $6,200. Our customer acquisition cost for the nurses is $350 one time to get the drug test, background check, get them insurance, and give them a referral bonus. And so we really do get that money back quickly. March of 2022, I launched StaffOnTap when I was graduating with my MBA. I had 1 nurse and 1 nursing home in Connecticut. Today, I work with 36 nursing homes across the state. I have 135 nurses on my platform, and we've done almost 1.6 million in total transactions. We've come a long way in a short period of time, and I have no plans of slowing down. In terms of competition, we are highly specialized in nursing homes. This means that everything we do matches the nursing home systems. Soon, we'll be able to integrate with the nursing home scheduling, payroll, invoicing, government reporting, so that I want it to be when the nursing homes use our system, it's just as easy as using their own, if not easier. So really create that stickiness. The other thing is that nursing homes hate staffing agencies, but I already have a seat at the table. They're willing to give me a chance. And that's why we've been able to grow so fast with little resources. We also offer a community to our nurses. So we're not just here's a paycheck, here's a job. We really offer a supportive community because travel nursing can be really isolating. What's very exciting though is the future of our tech. As I mentioned, we're scaling as a SaaS solution with those integrations, creating internal processes to get rid of those third-party fees. But I've identified a bigger problem. In Connecticut alone, there's over 200 temp nurse staffing agencies for nursing homes. There's less than 200 nursing homes in Connecticut, to give you perspective. We're opening up StaffOnTap's technology to be called Nurse Ranger. Now, these staffing agencies pay us a subscription fee, and they get access to all of the nursing homes. For the nursing homes, they now just have one platform and one contract to access dozens, hundreds of staffing agencies that have a quality assurance. With StaffOnTap and Nurse Ranger, we can scale across the United States and achieve that mission of improving the quality of care for seniors. Thank you so much, and I welcome any questions.
Thanks, Kayla. Why is it important that there be a specialized marketplace for nursing homes?
Sure. So in the past, there's been other staffing agencies that nursing homes are one arm of many things they do, so they can't do it that well. I mean, I was an operator and have horror stories of a nurse that had never walked into a nursing home, come into my building, didn't know how to use our electronic health system, and ended up walking out. So by having it specialized with nursing homes, it also means that the nurses that we're getting really know what they're doing. And nursing homes they're stubborn. If you've ever gone to a nursing home, I know my own family businesses, they like things particular. They have different software than other hospitals, for example. So by having it specific, it's a great launching point for StaffOnTap to get into this market, which is also why I've been able to grow quickly in just the 15 months since launching.
Great. So great presentation. Congratulations on the traction. I guess my question is like maybe a version of the same question before. How big is this market opportunity? What's your vision for the longer term play? And then I guess the second question, or maybe a third, is, and how do you kind of guarantee the quality of the nurses? As you said, there may be like really terrible nurses out there. Maybe that's why they are free. How do you make sure that there's good quality?
Sure. So the new federal regulations coming in, it looks like Biden's going to bring them in 2023, which is going to be even higher than what Connecticut just brought in March 1st. And just that regulation increase makes my market increase by 10 billion. So while this total market is about 34 billion, the healthcare staff recruitment agency market, my initial target market is 10 billion. But as you mentioned, what's the bigger vision? I'm looking, once I'm in these nursing homes, they also need temp housekeepers, dietary, interim administrators, interim social workers. And when I'm actually working with a company right now that offers a different type of service in a nursing home, that we can now serve them on StaffOnTap. So that's the bigger vision, really be a one-stop shop for all of their interim needs. And in terms of quality, another horror story that I've heard out in the industry, staffing agencies sending nurses that don't even have a license, just really scary. And so we make sure our due diligence process is really strong. I've had 700 nurse applicants, and the reason only 135 are on is because we do 2 interviews, we do another virtual orientation, we make drug tests, background checks, we need 3 references, we make them do education. So we make sure that our nurses, when they go in, they are very strong nurses, which is why StaffOnTap has a great reputation, and our word of mouth referrals from the nurses have been strong because they also want to work with coworkers who are strong nurses.
Thank you.
I'd love to learn a little bit more about the community aspect of what you're building. Kayla, can you share a little more?
Absolutely. I love the community aspect of this because with other staffing agencies, it can be really isolating when you're a travel nurse. You're going to a new location all the time, and it's not always the most welcoming. So we've been doing this on a startup budget, kind of doing virtual, but as well as community events. So community breakfasts around Connecticut. Another thing we did was we got them custom StaffOnTap scrub tops, so our nurses could identify each other in the field, as well as colorful name badges. And they loved that because it's not so isolating. You know it's a StaffOnTap nurse that's going to help you out when you're in the field. And if we won today, that's where the money is going, to those 135 nurses and the 700 applicants, really bringing that community piece, virtual and in person, to them through meetups, and then eventually empowering them to do it themselves. So we're building ambassadors for StaffOnTap who are excited to host bowling or host a book club, really to create that community and support in the nurse community.
Kayla, thanks for the presentation. Can you speak a little bit to the technology side? It sounded to me like you have StaffOnTap as sort of this core business that you're starting, and then the Nurse Ranger is sort of that technology platform that you're building. Can you tell me a little bit about that, and who is building that for you?
Yeah, StaffOnTap, I like to call as our MVP 2.0. We've been working off that, but one of my investors, he was the first CTO at Freshly and their first investor, built their first platform, and then helped them and Daily Harvest both sell for $1 billion. He's coming on as my interim CTO to build Nurse Ranger. He has a full engineering team, full branding team, and it's going to be ready in 5 months to pilot.
Great. So you're hiring in-house folks to come and do this work.
Yeah, Jay's staying. He'll be the CTO to be the leader on the Nurse Ranger tech.
And how much have you raised so far?
We raised 240,000 angel investors, and then this one VC, and about 50,000 from pitch competitions.
All right, that brings
And
us
that's
to time
time.
on the questions. Thank you so much. Thank you so much, Kayla. And then last but not least, our final pitch of the evening. But don't forget, we've got a lot of other, a lot of fun stuff on deck for you all. I'd like to introduce ZAMA Health, presented by Brendan. Welcome and good luck.
Brendan, you're on mute.
Apologies. Athlete mental health is in crisis. My name is Brendan Sullivan. I'm the CEO and co-founder of ZAMA Health, and I experienced this firsthand as captain of the track team right here at Yale, where we've had numerous teammates dealing with struggles of their own, from anxiety and depression to eating disorders and even suicide. But our team was not an outlier. And in fact, this is an issue that impacts over 140,000 student athletes every single day. And it's become such an issue that the NCAA has now passed new requirements mandating certain services specifically for student athletes, or they actually risk losing eligibility. And so ZAMA is well positioned to help athletic departments meet these requirements in a much more affordable and effective way compared to anything else available in the market. And that's because our athlete solution not only meets these requirements from a clinical standpoint, but we are investing in digital technology and AI infrastructure to optimize both mental and physical health outcomes for athletes. Specifically, our software encompasses a peer-to-peer support network, educational programming for coaches, and more than 70 self-guided science-backed pathways, which can be customized and recommended based on an individual's issue area and background. By leveraging automation and artificial intelligence, we can recommend specific plans for athletes without the need of human intervention. In addition, we're partnering with mental health clinics and companies throughout the country to provide their staff with athlete training so that when individuals are above a certain risk threshold, they can meet with a clinician who is in tune with the needs of the athlete community. Although we're kicking off with a D1 university in Texas this fall, college athletics is just the tip of the spear. We intend to push further into the gym and fitness industry after a successful pilot with a 30,000 member gym chain in California. I was actually on Capitol Hill a few weeks ago with gym executives from major companies like Lifetime and LA Fitness advocating on behalf of a bill being pushed by the gym industry to promote mental health and also prevent long-term chronic issues. ZAMA was the only startup asked to attend because we are the only behavioral health company positioning the gym and fitness industry as not only a powerful channel to acquire customers, but also one that can help solve this nation's mental health crisis. It's a multi-billion-dollar market opportunity because preventative healthcare is going subclinical as physical fitness and mental health are becoming interlinked. And you've seen this with wearable companies that are now trying to track biomarker and mental health data. 80% of Americans say their top reason for working out is their mental health. And ironically, mental health challenges are also the main reason people stop working out. And so ZAMA can help solve for this bridge and eventually help solve the engagement and retention issues that have plagued gyms for decades. And we also have the industry contacts to scale into the wearable and fitness space, but we're initially focused on colleges because these mandates provide an opportunity to gain market share quickly. Last year, we realized over $230,000 in revenue. We completed a Techstars program in December, and we're set to release a new mobile application this September. We're over 80% of the way through our 500K pre-seed round and continuing to invest in our growth. My co-founder is a former associate medical director for the only inpatient eating disorder unit and general psych unit in New England, and we're joined by advisors with deep expertise in clinical operations and professional sports. Most notably, Dr. Huberty is spearheading our science efforts. Dr. Huberty was the former head of science at COM, a multi-billion-dollar application in large part to the clinical studies that she conducted for them. And similar to what she did at COM, Dr. Huberty is going to add scientific validation to why our platform leads to better health and performance outcomes for athletes. We're a B2B subscription-based model. And unlike sports applications on the market, we also provide access to clinical support, peer support, and customized programming. And rather than using paid advertising to acquire customers, a tactic that has significantly hurt our peers financially, we instead leverage channel partners to acquire and differentiate ourselves via our athlete-focused care delivery model. So some may ask, why should you care if you're not an athlete or not physically active? Well, I'll tell you why. 75% of D3 athletes are on financial aid, and 40% of NCAA athletes identify as non-white. All to say, investment in physical fitness and athletics offers an incredible opportunity to invest in, support, and enhance marginalized communities. And for those that are physically active, ZAMA will serve as the premier behavioral health platform for athletes in the broader fitness community, and hopefully soon come to a gym near you. Thank you. Sorry for my inability to navigate slide decks.
You're good. Go ahead, judges.
I'll start then. Can you just run through how exactly does it work? I mean, I get the general concept of mental health, but it has lots of different manifestations for athletes versus, let's say, for a person at the gym. Can you walk us through the user journey?
Sure, absolutely. So you sign in the mobile application, you kind of put three main inputs of data: your background, are you an athlete, you're a gym goer, what your goals are, running a marathon, losing weight, or, something like playing time for college athletics. And then the main challenge areas you're dealing with. On the gym side, could be work-life balance, stress, or on the college side, it could be things planned for the future, financial concerns, things that are actually been shown to be the top reason for athletes. Based on that, you'd be recommended modules. They're 2 to 4 minute audio modules that have been developed by sports psychologists, dietitians, even private wealth advisors who run NIL collectives, since that's a major issue for college athletes. And so you would have those recommended to you based on those inputs, as well as access to the library. In addition, there's a community wall, so you can actually interact with other athletes. If you're a D1 football player at Alabama, usually suffering from similar issues, a D1 football player at Kansas, and so being able to actually communicate them and build that support is important. And then if you want to actually meet with a clinician, we are partnering now with local clinics and also national ones. So we would refer you to someone who'd received our training so that they're meeting with somebody who actually understand these athlete needs and have been kind of trained in the athlete experience.
And a quick follow-up, where exactly are you in the process? I mean, do you have the app built? How many users do you have on it, et cetera?
Yeah, sure. So we added 300 users last year, but it was more of a B2B to C model. Now we're going to be going to a B2B model. So we're going to kick off with a D1 university of 230 students in September. And we're also talking just in individual teams as well. So because we kind of have this software aspect, it doesn't necessarily have to be a full college program. It could be, like collegiate school. It could just be one-off teams too.
Thanks.
Did I scare everybody?
I'm curious, what's that trigger that would prompt a referral to a physical or mental health clinic?
Yeah, sure. So we have you can take a PHQ-9, and then so it's a quantitative. If you're above a certain risk threshold, we'd recommend you meet with an individual. But it is up to the student athlete if they want to, meet with a therapist. They would go through our platform to do it. So the athletic department, as part of this mandate, would be sharing that they're partnering with us to provide these resources. And so if there's an interest from a student athlete to actually meet with a clinician, they would log in and they would see which clinics we're partnering with that they could be connected in with, and use their insurance to actually meet with them.
Okay. And otherwise, it's the athletic department that's your customer, that's paying
Yeah,
customer?
exactly. So the athletic, it's a B2B business, right? So they're going to be paying us, irrespective of kind of who uses it from the kid standpoint. But yes, our customer is the athletic department, correct?
And is this revenues that you've shown so far, the 230K, is that from the athletic departments, and approximately what's your unit economics on that?
Yeah, sure. So the 230K last year was based on the B2B2C. So we were basically referred students from these departments, and they were using their insurance or paying directly. Moving forward, we basically charge a $2,000 a month subscription fee by the athletic departments. So and that's kind of a baseline fee. And then as we kind of work with larger schools that have like a Power 5 school, we would add additional digital features and kind of performance-based features so that we could charge a higher subscription for those schools.
Sorry, last question for me. How do you know this is working?
How do we know? Yeah, so basically 85% of, we surveyed our members last year, 85% of them said that they were able to hit all their mental health goals, agreed or strongly agreed that it hit their mental health goals. And essentially what we're doing is taking what we were really relying on clinicians and digitizing a lot of that. And the people actually doing that are college sports psychologists who kind of are following the best practices of what to do here. The other thing that we realize is that a lot of things people are coming in for don't necessarily always require a therapist. Financial worries, planning for the future, and academic concerns are the main reasons college athletes cite as issues. So those actually might be better suited to, have more tutoring help or more kind of financial literacy development or nutrition development versus just kind of strict mental health thing, which is what you would get from meeting with a therapist.
I don't know if there's time for my question, but
That's time.
Okay. Thank you.
Sorry, Lindsay. Okay.
Right. Thank you so much to all of our presenters. I hope you all enjoyed the presentations. We are about to whisk our judges away to deliberate and to come back with the winner. While they're doing that, I would like to introduce two more members of the team to talk a little bit about some of the other things that we've got going on, some of the semifinalists, and to highlight some of the work that some of the previous finalists and winners have been up to. So I'd like to introduce Adam Brenner and Michael to the stage to talk a little bit about what's coming next. Joe and I will join the judges on a separate call, and we will pop back in with the results shortly.
Adam, are you here? If not, Michael, I'll do this with you.
Sure.
So, okay. So, I'm not sure that Adam Brenner is here. So Michael Lewittis and I are going to do this. So when we announce this pitch competition, we always get an influx of incredible applications. And this year we got about 80 of them. And it was really difficult to get that pile winnowed down. We ended up with about 13 finalists. And what we'd like to do is just show you just a slide from each of the semifinalists because we thought that they were pretty amazing and we wanted to make sure that they had some airtime with all of you here this evening. So first I'd like to talk about Flow. Flow is an environmentally friendly solution to tackle the $11 billion ice dam market. So if you think about ice that accumulates on rooftops, on big buildings and small, like your home, Yale engineers have developed an opportunity to de-ice all of that and save a lot in maintenance costs, and also it's environmentally friendly. So you can see some of the details there of the 2 Yaleys who are involved in this company. If you do have any introductions you would like to make in the residential or commercial real estate community for them, they would really appreciate that. And if you would like to get in touch with David or Hector, please let us know and we will connect you. Michael.
Yes, if you can
Hold
turn
on.
to the next.
Yeah,
Sure.
there we go.
Okay, so the next semifinalist was Hengobi, and it's a plant-based multivitamin in a can, and it comes in 3 different SKUs. It has 6 times more functional ingredients than its competitors, including adaptogens and vitamin B. Founded by a Yale, and also the chief of staff is a Yale. The founder is Chad Oberbeck, who knows a little bit about fitness, having been on the lacrosse team at Yale and a 3-time Ironman participant. So as I said, they have 3 different SKUs. They're currently sold in 230 plus stores in New York with 450 plus reorders, and their lifetime revenue is 150,000. And they're currently in the nation's largest CPG distributors.
Excellent. So be on the lookout for them. Next, we'd like to highlight Scoop, Scoop Analytics. So this was founded by some business analytics veterans who built the technology of, I'm sorry, I'm just trying to, I have an obscured screen partially here. Basically, what Scoop wants to help business analysts do is really automate and streamline a lot of the business analysis functions that that they need to do to create efficiencies and not waste time and the analytics that they have to perform. So this solution really streamlines that. And Janet, and if you will please forgive me for oversimplifying your incredible product, please forgive me, but we thought that this was also a pretty amazing product. If you would like to get in touch with Janet Gurman at the Yale School of Management, who's an SOM alum, please let us know and we would be happy to put you in touch with her.
And the next semi-finalist is Agrifides, I believe. And that
Agrifides, yeah.
Agrifides, yeah. It's it's a tech-enabled private investment firm that's providing debt investment in the agricultural sector in Africa. And what they do is they raise capital from institutions, funds, and private investors, and then they invest in farmers and agribusinesses in Africa. So they've been in business for 1 year and they already have 600 farmers. They've supported farmers increase yield by 50%, and there hasn't been a single default. And they're ready now to assess a number of creditworthy, I should say, farmers, and they've got $2 million to deploy to farmers and agribusinesses. They're currently also raising a seed round, founded by Prince Boateng, and he's a graduate of the Yale School of the Environment.
Oops. Okay.
Well, so to determine the final 5 finalists, we needed to find independent reviewers to help us review the submissions. And I'd like to recognize and thank the experienced Yale alumni investors who stepped up to review decks and help us narrow down the field. Here are the 28 investors who helped us. Now, there are a lot of names, so I'm not going to be able to read through them all, but I'll give you a moment to look through them.
We're really grateful to all of you who did volunteer this year. Every year we've had a slate of volunteer reviewers to help us go through all those applications. And honestly, part of it is to make sure that we have a level playing field as we're considering all the submissions. We're looking for diverse reviewers. We're looking for female reviewers. We're looking for people with diverse backgrounds so that we are giving everybody a fair shake. So we're really grateful to all of you for the time that you volunteered and hope that you will do it again for us next year. Okay.
We really couldn't have done it without them. Wendy, please.
Absolutely. Okay. Thanks, everybody. Okay, so what we would like to do now, Michael, I know that you are a little time constrained, so you're welcome to spin off here. So what we wanted to do briefly while the judges are deliberating is we wanted to give you a quick update on last year's finalists. We were able to get in touch with a few of them, so we wanted to just share those updates with you. So first, Flowly, really popular, a popular company. They were our runner-up last year, and they reported that they've landed a partnership with one of the largest insurance companies in the United States, and they're also working directly with employers to provide Flowly as a health benefit. If some of you remember, it's a VR an app. It's a VR solution and an app that helps people with sleep issues as well as with pain issues. But they're still going strong. Also, you may remember Midnight Oil Collective, which was basically creating a fund for artists so that they banished the idea of the starving artist. If you were at the recent Yale Innovation Summit, you were probably part of one of their sessions. They helped to build a whole new arts track there. And so far, they've raised $500,000 and they've incubated 30 projects, and they have 11 seed stage investments. You can see more details on this slide and also scan that QR code. If you would like to get in touch with Frances to talk about this, please let us know. You can reach out with her directly at the email that's there, and we're also in touch with her. We'd also like to update you on Gymble. If you remember, this was an online platform for sports facilities and trainers to manage their operations and help clients book and connect them to clients. So they got into Techstars. They have a successful product launch in January of this year, and they are well on their way. They're looking at strategic partnerships. They've got 4.55 bookings per day. They're off to the races. And finally, Flip It. Flip It, if you remember, is a company that allows you to take something that may not be able to go through security in an airport, and you can kind of package it up and put it in almost like a little mailbox so that it gets shipped to you wherever in a different location, so you don't have to throw away the thing. So lots of great traction here as well. Since they pitched last year, they're generating regular revenue and repeat business. They're in conversations with the TSA. They have new airports approaching them. They also closed a friends and family round this past January. They're operating in 4 airports. They're definitely, off and running. So if you are interested in learning more about Flip It, you can get in touch with Natalie and Richard, founders at flipit.com. Okay. Next, I would just like to recognize our pro bono Yaleys, or our Yaleys who are offering pro bono services to all of our finalists. And there are 7 Yaleys who have generously offered high value pro bono services to all of our finalist teams. And I'm just going to run through all of them. First, there's Lisa Brand, class of 92, my bad. She is providing a 2-hour growth marketing session with the winner and 1-hour session, a 1-hour session with each of the remaining 4 finalists. So thank you, Lisa, for that. Adam Brenner, Adam, you're on now. Do you want to talk about the value, your services?
So, no, always excited to speak with any Yale founders about their businesses, but specifically, I'm going to be spending some time talking to the finalists about how to prep as they head towards a financing round, how to kind of make sure they've checked all the boxes so that, especially in an early stage, it's important to be really organized and make it simple for the investors because they're betting on your team. And I'm really excited to be just giving free advice to founders to kind of think through what they'll need from a legal standpoint and how to anticipate their round.
Excellent. Thank you so much, Adam. And Adam has already provided a ton of incredible advice very generously to many, many startups within the Yale ecosystem. So our finalists are really lucky to have direct access to him without having to seek him out. Next, we have Nikki Chang, who is a graduate of the School of Architecture. She's a founder of Meanwhile Partners, and she is the founder of a boutique design consultancy. So she will sit down with each of the 5 finalists and do 2 1-hour sessions on their brand strategy and design. And that is, everything from, their visuals to even their office and how they're presenting themselves to customers from a visual perspective. A great complement to Lisa's services. Next, another 4 Yaleys here, Erica Jennifer. She is a graduate of SOM, and she is a fractional COO, and she has generously offered to provide 4-hour sessions to each of the 5 finalists to advise them on financial planning, biz dev, strategy, and KPIs. Joe Ilfeld, you already met Joe earlier. She's an executive leadership coach. So she's going to provide one 90-minute leadership coaching session with each finalist team. I can tell you from personal experience, this time with Joe is incredibly valuable and insightful for your leadership style. I'd also like to acknowledge Michael Lewittes that you just saw here. The man knows everything about SEO. And so all of our 5 finalists will have expert sessions with Michael. And then finally, last but not least, Andrew Winnig, class of 91, elevator pitch coach. He is offering 1-hour expert sessions to all of our finalists to clarify their messaging and any messaging around their products and services. So the total value that I've listed here is over $32,000. It's actually a little bit under because I didn't have an accurate figure for one of our Yaleys here, but it's over $32,000 worth of services to our finalists. So even if they don't walk away, even if you don't walk away with that 10,000 or 5,000, you're getting some really high value professional services in return. So what I'm going to do now is I'm going to stop sharing my screen and I'm going to turn it back over to our judges and Joe, because it looks like we have a decision. Joe.
We do. We had amazing judges who were very decisive, and it was an honor to work with them all. And Tessie will be announcing our finalist and our runner-up.
Shall we start with the runner-up? Okay. First, I just want to say I was really impressed with all the pitches. I could tell that people put a lot of work and thought into doing this. So thank you. Our runner-up is REALIEF. The judges really appreciated that this was an important problem to be working on. The team has a great background, and that's a really unique combination of knowledge that you bring. Also, just one presentation point that we really appreciated was how you specified the milestone and sort of specified what, should you win this money, what you would be using it for. So that was much appreciated.
Yeah, we're so excited and thankful to have the support of your team, and thank you. It's an honor.
Awesome. And the final winner is StaffOnTap. We really appreciated, congratulations. We really appreciated the deep customer understanding that you showed in your pitch. There was a great founder market fit. You had a broader vision for the larger market that was really coming through, and we were excited to hear about the CTO that you had recruited with who had those exits. And one thing additionally that Gary wanted us to share is he'd love to have a conversation with you about fast tracking into the next round of Techstars. So
Wow.
Joe will be following up with you regarding that. So
thank you so much for the opportunity.
Great pitch.
Thank you so much, Tessie, for announcing. Congratulations to REALIEF and StaffOnTap. You guys are amazing, but you're all amazing. And I will turn it over to Wendy to wrap us up. Take us away,
Actually,
Wendy.
it's going to be Grace.
Oh, Grace, sorry.
That's all right. That's okay. I'm going to just pull up the deck so that she can have, hold on just a second. Grace, are you here? There she is.
I'm
Hello,
here.
Grace.
Hello. Thanks, Wendy. So again, we're so thrilled on behalf of the Accelerate Yale leadership team that all of you could join us this evening. Thank you again to everyone who applied. It was really an incredible experience for our team to read through so many great submissions. And before we conclude, we wanted to also announce an exciting new development for Yale Angels and for Accelerate Yale, our inaugural governing board. We've opened nominations to create a new leadership team that will scale our work to build the entrepreneurial ecosystem at Yale. We invite you to visit our website, accelerateyale.org, to learn about the board and to access the nomination form. And we highly encourage self-nominations, and particularly look forward to seeing nominations of women and underrepresented Yaleys. In closing, we'd like to thank our sponsors once again, the Yale University Office of Development, our platinum sponsor, Yale Ventures, our bronze sponsor, And our co-sponsors, Yale Women, the Yale Latino Alumni Network, Yale Gala, First Gen Yale, Yale Blue Green, Thai City, the Yale Club of Silicon Valley, the Y Startup Index, and Yale Fin. And of course, the YAA shared interest groups for making this event possible. We will be making a recording of this evening's webinar live on the Accelerate Yale LinkedIn, Facebook, and YouTube channels. Congratulations again to StaffOnTap and REALIEF, and a special thanks again to our judges and to the inspiring startups who joined us this evening. Thank you for tuning in and have a great rest of your evening.
Thank you, everyone. Thank you so much. Have a great night.